Hi, everyone. Welcome to our multiculturalism project on Iranian and Syrian anatomy influencers. My name is Elise.
I'm Tegan.
And we are EST.
So today we're going to be talking about Middle Eastern contributions to anatomy. But first, let's take a look at a visual timeline. Here we show different cultural contributors to the field of anatomy. You will notice that there are influencers from many nations. Early anatomists drew their foundation from the ancient Greeks, most notably Galen. For a number of centuries, their insights were highly esteemed and went largely unchallenged. Going into the 10th century, there was a notable shift in culture. Enter the Islamic Golden Age. The Golden Age of Arabian learning peaked between 750 and 850 CE, the century after the establishment of the Abbasid Caliphate, with its center in Baghdad, Iraq. Although taboo, some dissection did occur in this culture. It's important to note anatomical knowledge, though limited, due to potential prohibition of dissection, there are contradictory accounts that hinder a clear position on the practice of human dissection by Muslim medical professionals. But in any case, dissection was perceived as important in the medieval Islamic world for two reasons. Firstly, medical practitioners realized that surgeons who did not know enough anatomy were likely to do more harm than good when performing operations. For example, the 10th century Andalusian surgical author Al-Zahrawi wrote, "For he who is not skilled in as much anatomy as we have mentioned is bound to fall into error that is destructive to life." The second reason for the study of anatomy was to understand the wonders of God's creation. Between Al-Nafi's major discovery, Mansour's anatomy book, and Al-Razi's neuroanatomy findings, Middle Eastern contributions to anatomy have been indispensable.
First, we're going to speak about Ibn al-Nafis, the father of circulatory physiology. The Islamic Golden Age provided a large number of remarkable contributors to medicine, one of them being Ibn al-Nafis, an important scholar in anatomy and physiology. Born in Damascus and studied in Cairo, Ibn al-Nafis was the chief of physicians in Al-Mansuri Hospital and also personal physician of the Sultan. Apart from medicine, Ibn al-Nafis studied jurisprudence, literature, and theology. The number of medical textbooks written by Ibn al-Nafis is estimated at more than 110 volumes. His major contributions to medicine were the description of pulmonary circulation, anatomy of bronchi, and function of coronary arteries, which came out 3 centuries before modern science. He studied cranial nerves, gallbladder anatomy, and compared the structures of the eye in different species of animals with the human eye. He also wrote a treatise on eye diseases, a book about diet and healthy nutrition. He was the first person to challenge the long-held contention of the Galen school that blood could pass through the cardiac interventricular septum, and in keeping with this, he believed that all the blood that reached the left ventricle passed through the lung. Commentary on Anatomy in books 1 and 2, published when Ibn al-Nafis was only 29 years old, still is regarded by many as his most famous work. While it did not prove to be as popular as his medical encyclopedia in the Islamic circles, the book is of great interest today, especially for science historians who are mostly concerned with its celebrated discovery of the pulmonary circulation. First, he stated categorically that the interventricular septum between the right and left ventricle was not porous and could not allow blood to travel through it as critical in the Galen model. Second, since there is no communication between the right and left ventricle through the interventricular septum, it follows that the output of the right ventricle can only reach the left ventricle via the pulmonary circulation. Third, in a further short passage, Ibn al-Nafis state that there must be small communication between the pulmonary artery and the pulmonary vein. He then proceeds to discuss the anatomy of the body, which he divided in two types: the general anatomy, which is the anatomy of the bones, muscle, nerves, vein, and arteries, and special anatomy, which is concerned with the internal parts of the body, like the heart and the lungs. His death and legacy. Ibn al-Nafis died December 17, 1288 in Cairo, Egypt, at the age of 74. After his death, his house, library, and clinic were donated to the Mansourian Hospital. Ibn al-Nafis' mastery of medical sciences, his prolific writings, and also his image as a devout religious ruler left a positive impression on later Muslim biographers and historians, even among conservative ones like al-Dahabi. He had been described as the greatest physician of his time, and some even referring to him as the second Ibn Sina. Ibn al-Nafis' importance in the history of medicine was not fully recognized in the Western circles until quite recently. The majority of his work remained unknown into the West until the rediscovery at the beginning of the 20th century. Since then, a new evaluation of his work has been carried out, with a specific appreciation being given to the physiological observations which were ahead of his time. For science historians, Ibn al-Nafis is sometimes regarded as the greatest physiologist of the Middle Ages.
Right, next, we're going to talk about Mansur ibn Ilyas. He lived from 1380 to 1422 AD, and he compiled what is believed to be the first color-illustrated human anatomy text. It reviewed various body systems like bones, nerves, muscles, veins, and arteries. The origins of the illustrations are debated. It is known that most are not Mansur's personally, and it is even believed that a scribe contributed to a number of the illustrations. And these colored illustrations and dissections previously went against Islamic law, and that's why this text was so very revolutionary in its time. In the text, the organs were ordered by a hierarchy of importance, the first being cardiovascular and last being reproductive. These anatomical teachings from this text were heavily favored for the next 2 centuries. And within the text, there are extensive references to the Quran and other Islamic leaders to highlight Islam's strength and to influence religious tolerance in the region. Here we have a couple illustrations from the text, the one on the left being a pregnant female with a tiny little baby in the abdomen in a breech position, which is sideways. And on the right, you can see an illustration of the cardiovascular system. Further on the organ hierarchy and new teachings within the text, as previously mentioned, there was a ranking that was different compared to previous Persian and Islamic medical chapters, especially with the chapters on embryology. They also, the ideas differed from the previous Hippocratic theory, which states that the brain developed first in utero, and in the book, it stated that the heart is the first to develop, which is actually correct. And this was in agreement with Avicenna, who is another Persian physician. So again, the heart was first to form in utero, and this was believed to contain pneuma and provide a source of heat and initial nourishment to this pneuma. Now, pneuma is ancient Greek for breath, but within a religious context, meaning a soul or a spirit. And it was also thought that this pneuma needed to be contained, or else it would be destroyed. Also within the text, it claims that a 6-month-old or 24-week-old fetus could survive outside the womb. And for reference, at that time, a fetus weighs about 2 pounds. Now this is possible, but with intensive care, which was not quite available at that time. And the skeleton illustration, which I'll show in a moment, resembles a body laying prone on an exam table, so it is viewed posteriorly. So here we have the picture, and you can imagine, again, that you're looking at it posteriorly and the body is laying prone, and the head almost looks upside down because the head is looking up.
Okay, so next we have Ibn Zakaria al-Razi, also known as Abu Bakr Muhammad ibn Zakaria al-Razi, or al-Razi for short. Al-Razi was born in El Rey, a town in the southern slopes of El Burz Mountains near present-day Tehran, Iran, in the year 865 AD. Among his discoveries in alchemy, he is credited with the discovery of sulfuric acid and ethanol. He also is considered the original portrayer of smallpox. While serving as the chief physician in Baghdad, he was first to describe smallpox and to differentiate between smallpox and measles. Apparently, European physicians continued to confuse these two illnesses until recently. He was a pioneer in the treatment of mental illnesses. When he was the director of the main hospital in Baghdad, he established a special section for the treatment of the mentally ill. He treated his patients with respect, care, and empathy. As part of discharge planning, each patient was given a sum of money to help with immediate needs. This was the first recorded reference to psychiatric aftercare. He wrote more than 224 books on various subjects. His most important work is the medical encyclopedia known as Al-Hawi fi al-Tib, known in Europe as Liber Continens. Liber Continens, a posthumous compilation of his readings of Greek and Roman medicine, his own clinical observations and case studies, and methods of treatment during his years of medical practice. The fame of al-Razi as one of the greatest Muslim physicians is mainly due to the case records and histories written in this book. Translated, the comprehensive book on medicine, this 23-volume textbook that provided the main medical curriculum for European schools well into the 14th century. His books in medicine, philosophy, and alchemy had greatly affected the human civilization, especially in Europe. Some authors considered him the greatest Arabic Islamic physician and one of the most famous known to humanity. So his contributions to anatomy are in the area of neurology and neuroanatomy. He stated that nerves had motor or sensory functions, describing 7 cranial and 31 spinal cord nerves. He assigned a numerical order to the cranial nerves from the optic to the hypoglossal nerves. He classified the spinal nerves into 8 cervical, 12 thoracic, 5 lumbar, 3 sacral, and 3 coccygeal nerves. In his clinical case reports cited in his books, Kitab al-Hawi and al-Mansuri fi at-Tib, he showed an outstanding clinical ability to localize lesions, prognosticate and describe therapeutic options, and reported clinical observations emphasizing the link between the anatomical location of a lesion and the clinical signs. Al-Razi was a pioneer in applied neuroanatomy. He combined a knowledge of cranial and spinal cord nerve anatomy with an insightful use of clinical information to localize lesions in the nervous system. In addition, he is credited as the first physician to clearly separate and recognize concussion from other similar neurological conditions. Razi's used the differential diagnosis approach for the evaluation of his patients, an approach that continues to be used in modern medicine today. This concludes our presentation on Iranian and Syrian influencers. Here are our references. We hope that you will take from this that their legacies live on and have helped advance our understanding and progress in science, medicine, and beyond. We hope you found our presentation insightful. Thanks so much for tuning in.